The least invasive type of surgery that we do is something called a lymphedema bypass or lymphaticovenous bypass, depending on the paper that you read. This involves going to the operating room, going under a general anesthetic, and then using a machine with some dye injected into the hand to map out the lymphatic channels. After this, we make small incisions in the arm, usually about 2 inches in length, and using an operating room microscope, find those lymphatic channels. Once we've found them, we then reroute them into neighboring veins in order to reroute the lymphatic flow to avoid the obstruction that's found up in the axilla or the armpit. Another form of surgical therapy includes lymph node transfers. Lymph node transfers is a much more invasive operation that we usually reserve for people that have had long-standing lymphedema and most likely do not have the lymphatic channels that we can use to reroute. Lastly, as mentioned before, our form of debulking, or removing the fibrofatty tissue, is usually used in patients that have chronic lymphedema. These are patients that have had it for a number of years usually. It is unlikely that through a physiological operation alone that we're able to return the size of the arm back towards the other arm. In doing so, or in performing one of these debulking procedures, usually it's in the form of liposuction, we can remove 1 to 2 liters of this fibrofatty tissue and return the arm back down to its normal size.